Just a quick note that we are recording this session, and we will be posting the recorded session on our website so that those who are unable to attend, who wanted to hear the presentations, can do so. I'm delighted to welcome you to Childcare Now's webinar. I'm Morna Ballantyne, and I'm honored to serve as the Executive Director of Childcare Now. We, as an organization, have been advocating for the development of a Canada-wide system of early learning in childcare since 1982. And we're very pleased to host this webinar this evening or this afternoon, depending on where you're located, a webinar that will deal with both the success and the challenges of Canada's new $10 a day childcare plan. I want to make a note right at the start that our presenters will be speaking in English. However, we have arranged for the session to be simultaneously interpreted into French with the assistance of very highly skilled and professional interpreters. So to hear the webinar in French, you have to find the icon that looks like a globe at the bottom of your screen. If it's not visible, you maybe have to click on the icon that says more, and that will get you to an icon with a globe symbol, and you click on that and you can choose French. The default language for this session is English. I'd like to acknowledge, as we do at the start of all of our events, that Childcare Now's office is located on the unceded, unsurrendered territory of the Algonquin Anishinaabe Peoples and Nation, and that our organization is also active on ceded, unceded, and contested lands and waters across Turtle Island. In our work, Childcare Now strives at all times to respect the inherent rights, the historical claims, the treaty rights of all Indigenous peoples, and we are fully committed to advancing the implementation of the Indigenous Early Learning and Childcare Framework. Tonight's webinar concludes the childcare movement's 10 days of action for more and better $10 a day childcare. Our panelists tonight are going to discuss the $10 a day plan from different perspectives with the help of Laurie Monsebraaten, who has generously agreed to serve as our moderator. Many of you will know that Laurie is retired now. She was the social justice reporter for the Toronto Star, where she worked for almost 40 years, writing about poverty, inequality, and social programs, including childcare. Laurie is and was everything we want of a journalist. She's an incredibly good, clear, accessible writer. She's a reporter who seeks and she reports on the experiences of people often ignored. She's a journalist who knows her subject matter well and contributes truth and evidence to public policy debates, something that is sorely lacking, especially these days. We've decided to keep the session tonight to 1 hour, so it's actually unlikely that there is going to be time for anyone on the Zoom call other than Laurie to ask the panelists questions. However, we invite you to use the chat box to share your reflections, call for clarification, raise concerns, and I promise that we're going to find a way to address them either tonight or some other time in the future. Laurie, over to you.
Thank you, Morna, for that very generous introduction. And it's so wonderful to be here to see so many familiar faces and many names on the bottom of your little screens that are all in a checkerboard in front of me. So many folks that I've spoken to and read your reports and interviewed over the years. It's wonderful to see you all here tonight for this very interesting discussion. And I'd like to now introduce the main reason we're here tonight, which is to hear from Jim Stanford, who is one of Canada's best-known economists and, as he mentioned, the director of the Centre for Future Work, which is a think tank based in Vancouver, BC. Jim served for over 20 years as an economist and director of policy with Unifor, Canada's largest private sector trade union. He's also the Harold Innis Industry Professor in Economics at McMaster University in Hamilton, Canada, and an honorary professor in the Department of Political Economy at the University of Sydney in Australia. Jim has provided research and advice through numerous federal and provincial government panels and inquiries on economic policy, innovation, jobs, and social policy. In 2020, prior to the federal government's decision to finance a new Canada-wide early learning and childcare system, Jim released a report which estimated the potential economic benefits in Canada arising from such a national ELCC program. Last month, Jim used a similar approach to quantify the impact that the $10 a day plan has had in its first years. And tonight he's going to share his conclusions. Welcome, Jim.
Laurie, thank you very much, and to Morna and your whole team. It's such an honor for me to be a partner in this great, great movement, and also so wonderful to see this movement making some progress and actually making a difference in people's lives and in how we're structured as a society. So thank you so much for having me. I'm going to share a few slides as we run through the facts and figures about the rollout of the $10 a day program, and showing that the things that we predicted would occur if we provided universal, affordable, accessible childcare are in fact occurring. It's in a way not surprising, but it is sure gratifying to see that the things that we argued for, in fact, were quite legitimate, and that was the point of this paper. So I know we're pressed for time, so I'm going to jump right into the material. The full report that Laurie mentioned is available at our website, centerforfuturework.ca. So please check in there if you'd like to see the details and the methodology and the sources and so on. And of course, join the conversation online. So in terms of the genesis of this work, of course, economists have argued for years, even some very mainstream economists. You don't necessarily have to be, coming from a social justice or left-wing perspective to recognize that providing high quality, affordable, accessible early learning and childcare has huge economic implications, generally categorized in three broad buckets. The first one is the jobs and economic activity associated with the actual work of providing that care. This is a big industry now, and when you grow that industry, you're growing the economy. Second, and perhaps the most important among the three buckets, is how it facilitates the greater participation in paid work by the parents of the children who are going to those centers, particularly, of course, women, given the continuing uneven distribution of unpaid care work at home. And the international and Canadian evidence is rock solid that providing accessible care leads to more female labor supply. And then there's another whole category that is harder to quantify, but also very, very important, which is the benefits occurring from the fact that children in these centers in high quality ELCC develop stronger capacities for learning, for communication, for group work, for problem solving, and those capacities stick with them through life. And that's good for them, obviously, and their families, but it's also very good for the economy. So as Laurie mentioned, we partnered with Childcare Now 4 years ago now for an initial report that simulated the benefits of a national childcare program that we were hoping for and fighting for. Setting the bar high, we simulated the impacts of a program that would be equivalent to what's in Norway, a world leader in ELCC, that would have enough spaces for over 90% of preschool children. And we showed that those benefits would be enormous in those three buckets. And in fact, we showed and argued, and this is consistent with other research, that the fiscal impact of the economic growth stimulated directly and indirectly by that program would be so significant it could pay for the program itself. And so again, this is literally one social program. I know we throw this phrase around a lot, but with childcare and early learning, it's true. It's a program that literally pays for itself because of the economic growth that's stimulated, and then the fiscal take that governments get from that growth, not by raising taxes. And no, Pierre, not from the carbon tax, just from the taxes that are already in place. Governments get back more than enough money from the program to pay for it. Now we have the chance to see this happening. And this was, in a way, one of the most gratifying reports I've worked on, because it's one that we can all feel, I think, proud about how we're contributing to this, but also urgent that we have to defend it and keep it growing. So Let me run through some of the benefits here. First of all, the direct jobs in the ELCC sector, tremendous. Net increase of 40,000 positions since 2019. You see the dip in that number during 2020. That was the lockdowns when many centers had to close temporarily. But we've regained the effects of the pandemic and then added 40,000 net new jobs since then. That's a lot of jobs. In fact, if you list the different industries in Canada that are creating jobs, the ELCC sector is in the top tier of job creating industries. Look at the other industries that are there. This is, I think, an important fact because people in Canada assume that the leaders of economic growth are the traditional industries, coincidentally, male dominated, like resources and manufacturing and so on. And that's what powers the economy forward. And first of all, it isn't true. Look at this list. 7 of the 10 top sectors are all in the care and human services industry. Resources isn't there because natural resources have been shedding jobs, not adding them. But childcare is their sixth largest at this level of disaggregation source of new work in Canada over the last 5 years, which is something, again, to be proud about. It's not just the quantity of jobs in the sector, the quality of jobs has been improving thanks to the additional money and the negotiated provisions in most provinces around things like wage grids and training qualifications and where possible, the unionization of these jobs, the creation of new pension plans for ELCC workers in some provinces, et cetera, et cetera. Just the average weekly earnings in the sector have grown substantially for two reasons. One, because the hourly wages are higher, but also the jobs themselves have become more regular and more full-time. So hours of work, which were traditionally lower in the ELCC sector, have increased notably and are converging with the overall average. So it's still a low-wage industry, and we've still got a lot to do to lift standards and wages and compensation and stability and training in the sector, but it is getting better, a better place to work. And this is, of course, essential to attract people to work in this sector because we need those people to keep it growing. So in aggregate, the combination of more people and more hours and better wages has really supercharged the earnings for workers in the ELCC sector, which have grown by over 2/3 since 2019. And that is a lot of new purchasing power. That's $4 billion of new purchasing power just from the earnings, additional earnings of ELCC workers during the initial years of the rollout of this program. So $4 billion, I can tell you, those workers are very good at caring for our children. I'll tell you, they're also very good at spending their money as soon as they get it, sometimes thanks to the miracle of credit before they get it. So that's $4 billion of additional spending power in an economy that's been staggering for the last couple of years because of high interest rates and the after effects of the recession. The impact on female labor supply, of course, is a critical dimension of the benefits of ELCC, and we see this happening big time in Canada, and it's very, very important. We've seen since 2019 a 1.4 percentage point increase in female labor force participation in the core parenting age cohorts, age 25 to 54 here. And that's 1.4% doesn't maybe sound like a lot, is 110,000 people additionally participating in the labor market for paid work. Obviously, not solely because of the childcare program. There's cultural changes and women's different views of what their life should be like, more interest in paid work, etc. But it couldn't happen without accessible childcare. And this is, again, clear from the international and Canadian evidence. It's not just that more women are participating in the labor market, it's that they can work more hours as well. In the past, when women could work, they often found they could only do a part-time job while still trying to juggle the unpaid care work that they did at home. So we've seen a significant decline, 4 percentage points in the incidence of part-time work among core-age women. Again, much of that since the rollout of this program began. That's worth another 65,000 jobs, full-time equivalents. So the two things together, more women and more women working full-time rather, is making a big difference to our labor market at a time when employers across the country have been very outspoken in complaining about a labor shortage and the need to attract more workers. So here is a combination of 175,000 more workers to help fill those positions. So if we put all these things together, the additional GDP that came from the expansion of the centers themselves, then the indirect and induced economic activity that came from the center's supply chains, for example, buying goods and services from all of the private industries that supply the ELCC sector, and the downstream spending activity by ELCC workers. And then finally, the productivity that results from 175,000 more workers, full-time equivalent, in the labor market, most of them employed and producing. So put all that together, that's a lot of GDP that results. We estimated about $32 billion of GDP. And remember, in Canada, the government takes about a quarter of all that and just through the existing portfolio of taxes. So government itself has collected several billions of dollars in additional revenue thanks to the economic activity from this program. Again, we are seeing this program pay for itself. This was, in a way, the most astounding fun fact that I found in this review. The economy had been staggering in 2022 and 2023 because of the high interest rates that the Bank of Canada put in place to try and bring down inflation. And we came close to a recession, but we didn't have a recession. But if we took out, if we hadn't had those direct and indirect gains from the childcare expansion, we actually would have had a technical recession, which economists typically define as 2 consecutive quarters of shrinking GDP. So this was my simulation of how the benefits of the expansion of this program led to, in a way, a growing increment in overall GDP that actually saved Canada from a recession. So that's actually astounding, and it shows the important footprint. Another way that the ELCC expansion was visible macroeconomically was in the inflation side. Of course, a commitment to reducing fees in centers participating in the program by 50% in the first couple of years, heading towards $10 a day. And that led to a very substantial reduction in the average price of childcare services. And most people aren't aware of this, but when Statistics Canada goes around each month, they measure the price of bread, the price of gasoline, the price of housing, etc. They also measure the price of childcare because it's something that consumers have to buy. And that decline in the price of childcare was big enough to actually pull down the national average inflation rate, especially for 2023. At a time, again, when Canada was grappling with high inflation. So it's another sign that providing social entitlements like early childhood education is important to the standard of living, even at a time when affordability concerns were front and center. So let me wrap up. This is a very quick tour of the findings, but please check out the full report. Even though it's early days for this program, we are seeing significant benefits from it. And those benefits are entirely consistent with what we predicted. And again, that is just a wonderful thing to be able to say. And we will see those benefits get bigger as the program continues to expand, especially if we're able to address the supply constraints and get those waiting lists gone. Then we'll see the big changes, including still more female labor force participation. There's still a gendered participation gap in Canada. And that is an enormous untapped potential for our economy, as well as, of course, the long run benefits for the kids that go through these programs. So I was heartened by these results. I hope you are too, and I hope it helps us cement continued support across the country and across the political spectrum for this program that is so important, not just for equality and well-being, but also for our economy. Thank you very much, Steve.
Thank you, Jim. That is quite encouraging news. Warding off inflation, a recession rather, and lowering inflation off childcare. That's amazing. But one thing I noticed there from the data that was collected by Stats Can in your report, showing that both the job growth and the wage growth in the ELCC sector, for those in our group and those in the broader public who are working in childcare, who have seen many leaving for better paying jobs, how do you sort of explain the discrepancy between the hard data that you're finding and the lived experience of sort of what's happening on the ground, centers scrambling for staff because folks just are giving up on it?
Hmm. Well, I mean, it is still a below average wage industry. So despite the progress on hourly wages, the wages are still lower than in many other parts of the economy. So again, I think that is it's going to make recruitment easier when wages are better, and especially as we put in other things to improve job quality, like stability of schedules, for example, access to benefits and pensions. Very encouraging that a couple of provinces have even put in a group pension plan for ELCC workers. That's tremendous. But it's still a challenge. Now, those workers are there. We count now 170,000 of them in Canada, and that is up. So it is a challenge to recruit and retain those people, no doubt about it, and it will be. But it's happening. Those people are there and they're working. So in that regard, more is what we need. More funding for wages, for pensions, for training, and more expansion of the centers themselves.
Right. The goal is to keep them there. So we're coming up on a federal election. What lessons do you think that the federal parties should take from your findings as they develop their platforms going into the next election?
Hmm. Well, I think the lesson should be crystal clear if we focus on the actual facts rather than on ideology. The lessons are clear that this is a program that is boosting Canada's economy. It's first of all, first and foremost, it's good for kids and it's good for parents. It allows parents to participate fully in work and the rest of economic life, and that should be motivation on its own ground. You know, in a way, it's kind of disturbing that you have to come up with an economic case for a program that is so important on human and social grounds. But I think it's undeniable that the economic benefits of this program are happening right now before our eyes in real time. And so that should, I think, cement support from the different federal parties for committing in advance of the election to maintain this. I'd like to see that from every party. Now, all of us know that it's been a long, long fight to get this program here, full of ideology. And I can tell you from the reactions to the media work and so on that I did around this report, there are still some people out there who think publicly funded universal childcare is a communist plot to pollute the minds of our children. And literally, I've had messages, I'm sure all of you have as well, that women should be at home caring for the kids at home. And it's astounding that those ideas are there, but the way that politics has unfolded in Canada and other countries in the last few years, unfortunately, creates more space for that. And you know full well that there are some parties that are going to be, in a way, tolerating or even encouraging those sorts of attitudes as part of their general claim that Canada is broken and we have to throw the bastards out at the next election. So, I'm worried about how this will play in the election, but I think if it was all about economic facts and figures and economic rationality, every party, including the Conservative Party, should look at this and say, this is a great thing, and we're going to commit to continuing it. I would love to see that.
Well, I hope you've sent your report to the opposition leader's office because you're right, money talks, and we're having an affordability crisis, and as your report clearly shows, this is having an impact. I'd like to bring in our panelists to add some of their perspectives now to this report. And tonight we've got with us Michele Lupa, who is Executive Director of the Canadian Mothercraft Society, which is an internationally recognized NGO that delivers programs and services to families with children under the age of 6, including prenatal outreach and support to vulnerable women, licensed childcare, family support programs, special needs support, and infant and early childhood mental health. Mothercraft also operates a college delivering post-secondary education and professional development training to the childcare and early years sector in Toronto. Michele is both a leader in the delivery of early learning and childcare, and is an active participant in shaping policy and system-level activities locally, provincially, and federally. Welcome, Michele. And as the director of a large not-for-profit childcare provider in Toronto, which is a city that has a long history of high operating costs, high parent fees, and long wait lists, Mothercraft still chose to be part of the $10 a day plan from the start. What have been the benefits and what have been the challenges?
So the fact that we're having this conversation, I think, is the best benefit, because we actually have a system. I know for myself, a little bit of a personal story is that I started my career when I in this sector when I had my first child as a single parent who required subsidy. And the system was difficult to navigate, it was expensive, and it set up sort of those who have against those who have not. And so, as an organization that's been involved in early learning and childcare since 1931 and training the professionals who work with young children since that time, we couldn't be happier that we're having this dialogue. And I want to say a huge thank you to Jim and to Childcare Now for producing this report, because our perspective has always been that early learning and care is important to children, first and foremost, and for families for all the reasons that Jim just outlined. But it's also important for our future. And so we've been doing this work for the better part of a century to really ensure that as many families have access to it as possible. So we're seeing that start to play out. So we have seen for ourselves an expansion of our childcare service through the pandemic, which was a pretty interesting experience, and the highlighting of the importance of early childhood education through that crisis. We really are an essential service, not only to the economy, but to the social fabric of our country and our communities, most importantly. So seeing the shift, some of our constraints pre-CWELC were really about the limitations of a market-driven system. So you could only charge as much as parents could afford to pay, and then you could only pay your staff as much as you could generate in terms of revenue. And there's a lot, and even as a nonprofit charity, we could never get to the levels that we might have liked. So we're not there yet. I would love to see some national standards around qualification, around minimum compensations, about things like benefits and pensions, et cetera. But, the benefits of seeing this system unfold, and even though it took a pandemic to sort of highlight the essential nature of childcare, we'll take it. So as an organization, one of the things that we're most happy about and really working hard to realize is increased access for equity-deserving communities and families. So in Ontario, which is my reference point, in Toronto, because that's where I live, we've seen our provincial government sort of establish some priorities for expansion, which is really important, to go into underserved communities, to focus on low-income communities, racialized communities, so that families who haven't necessarily had access in the past are able to get access. Now, we do have a lot of challenges as we go along that route, but for our organization, we are deeply committed to expanding. We opened, as I said, 2 centers during the pandemic. We got 3 more in the works. Here's some of the things that we're up against, and that is sort of the stability of the revenue streams through the funding formulas that are attached to CWELC. And thankfully, Ontario will be shifting come January to an expense-driven, cost-based funding formula as opposed to a revenue replacement model, which means that we can actually say, this is what it costs, and this is how you need to fund us. Are we at the point that we would like to be? Absolutely not. But we're having those conversations, and I think that some of that shift in Ontario was the result of advocacy that many of us did to say, it's not good enough just to replace revenue. You've got to look at the real costs, and you've got to attach your funding streams to what those real costs are if we're going to actually achieve the system that we want to see for our kids, our families, and our communities. So I'd say that was a really important success. Just the importance of the work and the essential nature of the work, and talking about ECEs. I do think a lot about the pandemic and the fact that 3 weeks after the entire country pretty much shut down in Ontario, we had emergency childcare set up. Everybody was talking about our healthcare heroes, and rightly so, but we needed to be talking about our childcare heroes who allowed those healthcare heroes to do their important work. And they were there, taking all those risks and following all those rules. And it really did highlight the importance of ECE. And we've got to get beyond those economic conversations to say this is important to the social fabric of our country. And it's going to take time. It's going to have some bumps along the road. We're up against some of those now. And so what I would highlight is that the absence of some sort of rationalized provincial wage grid in Ontario, and I know other provinces and territories have established them, would be hugely helpful. Even for those who stay within the sector, rightly so, they chase the money. I would too. I did too when I was a single parent on subsidy. So, we need to put some of the infrastructure in place that creates a stability for the workforce so that we can achieve the bigger goals of CWELC. I think for employers, really being able to have that stability in our workforce, whether we're talking about the ELCC workforce or we're talking about the broader labor market, we know that workers stay when they have stability around the things that matter most to them in their lives, and that's their children, that they're well cared for, that they're in environments that are safe and secure and are stable. I think, the challenges that we've confronted as an organization trying to expand under CWELC and allow our governments to hit their targets for accessibility has been a lot of the fundamentals, access to capital. Some organizations have access to capital, others do not. The reality is you got to find a space, and it's got to be suitable for childcare. You got to be able to license it. And in a competitive real estate market, that's really, really difficult when you're up against condo developers and shopping mall developers, or even just homeowners who really think that there's maybe a greater than real value on their property. There's a lot of municipal red tape that you got to get through, and we're right in the middle of that right now, to be perfectly honest, with some properties we managed to secure, and that's about zoning and permitted uses and special bylaws that municipalities have. So there's a lot of talk about auspice being what's holding back. It's certainly in Ontario, the expansion of childcare, and that if we just opened up the doors to the for-profit commercial operators and didn't maintain the proportionality that we have in place right now under the agreement, that we would be seeing way more centers opening. And I will really challenge that as a nonprofit that is trying to expand. It's not about auspice. There are some additional hoops we have to go through with financial institutions, which those need to get sorted out. Why does it take more for me to borrow money than a childcare operator who happens to operate under a different auspice? But all of those complexities need to be streamlined and fast-tracked through policy amendments and introduction of new policy, through bylaw amendments, through a willingness on the part of all orders of government to really do what needs to be done to make this a reality. And I think I'm at 5 minutes, so I'm going to stop.
Wow, wonderful. No, I agree with you. Having covered municipal government, and we're hearing about all the red tape to build housing. Well, there's red tape to build childcare too, and we need to be hearing more about that. Thank you, Michele. I'm going to move now to Nguyen, who is a dedicated registered early childhood educator in Ontario with experience in both regulated and informal childcare settings. She is also an experienced policy researcher and advocate who is focused on equitable access to ELCC and anti-racism within the ELCC sector. For the past year and a half, Ta has been working as a policy and outreach coordinator for Childcare Now's Educators Matter project, which is collecting and disseminating information on Canada's early learning and childcare workforce and developing recommendations to governments on how to address the current retention crisis. The project's latest report, released last week, makes recommendations related to wages and benefits, including pensions. So Ta, as a registered early childhood educator who's worked in a variety of settings, you're working on a project that's examining what governments could be doing to address the many challenges facing the childcare workforce, such as staff shortages, low compensation, difficult working conditions, which have contributed to the problem of high turnover and recruitment. Has the $10 a day childcare plan made things better or worse for those who work in the sector?
Thanks for the introduction and the question, Laurie. So as an educator who actually quit my frontline position due to low wage and little job security, I can say with confidence that childcare as a profession now has started to look very different compared to in 2020 when I left my last job at a childcare center. I didn't see a future back then as an ECE, but now, thanks to the 10-a-day childcare plan, I see some of my peers who left for similar reasons are returning to the sector, drawn by improved wages and benefits in participating programs. But it's not a universal experience for sure. Many ECE graduates that I know are still struggling to find stable and well-compensated jobs. So I live in Ontario, and let's break it down a little bit here. Unlike 8 other provinces and territories, Ontario doesn't have a wage grid. Instead, we have a wage floor and a wage top-up for ECEs. These are a very helpful tool, but they're quite limited. A wage floor sets a baseline, minimum standards, and top-ups provide temporary and conditional relief to address wage gaps. But a wage grid could offer something more transformative, like a permanent structure where educators are compensated based on qualifications, years of experience, and job responsibilities. A successful wage grid also lays out a clear pathway for wage progression and career advancement. As an educator, gain more education and experience and take on more responsibilities. So I think the fact that most provinces and territories in Canada now have a wage grid is a big gain, although it's not perfect for sure. Wage rates under these grids are still often too low to really fairly compensate educators. And there's also a lack of a formal mechanism for early childhood educators and childcare workers to have any input in determining their wages and other details on the wage grids. But even so, I think having the structure provides a critical foundation for us to work with and to improve. And jurisdictions without one like mine certainly have a lot to learn. Um, and beyond wages, the 10-a-day program has prompted some real gains in benefits and pensions, which are very essential for retention. And that's what I would care deeply about if I was to work in ECE again as a frontline worker. And some provinces are making real gains here. For example, under the 10-a-day program, Nova Scotia introduced a defined benefit pension plan and extended health and dental coverage for ECEs. PEI also added a defined contribution pension plan, and Newfoundland and Labrador now offer extended health plan as well. And these measures offer much needed security, helping ECEs like myself access healthcare and plan for our retirement. These are all key factors for retention. But the challenge, as we can see, remains that not all provinces and territories have committed to these measures. Another significant success under the 10-a-day program, I would say, is the increased funding for post-secondary ECE training and professional development. So if you want to pursue a career in ECE right now, there's more chances that you would find a scholarship or bursary of some sort, as they are more accessible across Canada now. And these are a vital step toward addressing the shortage of workers and reduce barriers for those wanting to enter the field. So all of these to say that I believe for the workforce, the 10-a-day childcare program has laid the groundwork for significant improvements in wages, benefits, and training, while still leaving room for further improvements. And there are other areas that could be more front and center in order to strengthen this system for sure. For example, factors that affect day-to-day working conditions, such as staffing ratio. We don't see a lot of change in that area. Or as an immigrant myself, I care about the role of immigration in addressing the shortage and concerns about immigrant ECEs and childcare workers being treated unfairly in the sector. So these challenges, to me, it highlights the importance of moving toward a publicly funded and managed system, because this is something that has potential to fix those problems, certainly not in a market system. So this is, I believe, something that the 10-a-day childcare program aspires to achieve, but is not yet fully realized. Um, and the experience felt on the ground by educators like myself definitely varies across provinces and territories depending on how agreements are negotiated and implemented. And there's still much work to do to ensure that these benefits that I just mentioned can reach all ECEs and childcare workers across Canada. But I believe this program holds tremendous potential, and that with continued evolution and responsiveness to the needs of educators and childcare workers, it can deliver on its promise, not just for children and families, but also for the workforce that supports them.
Thank you, Todd. That's very encouraging. Despite the unsettled reality that's still out there, and maybe we'll see you back in the ECE classroom one day.
I hope
although
so.
the work you're doing with childcare now on this workforce matters project is really encouraging and really important, getting the word out. And I think as other provinces see what each other is doing, that there's perhaps it'll be the race to the top as opposed to the race to the bottom. Thank you, Todd, for the work.
Absolutely.
Our next panelist is Viveca Ellis, and she is the executive director of the Center for Family Equity and a founding member of the organization, which brings together lone mothers and caregivers impacted by poverty and lack of access to legal aid, housing, and childcare. Recently, the center partnered with UBC to carry out a qualitative research study that included the engagement of low-income mothers across BC, some of whom had access to the province's $10 a day childcare and the affordable childcare benefit, and some who did not. You've done some very important work addressing the experience of low-income lone mothers accessing childcare in BC. What did your research find with respect to the benefits of reduced fee childcare?
Okay, well, hello everybody, and thank you, Laurie, so much, and thank you to Childcare Now for having me today, for Jim for your brilliant report, and for everything I've learned from all the presenters so far. I absolutely love this question because I just want to rush forward and share the sort of the gloriousness of the impacts that we captured through our research when it comes to how $10 a day fully universal childcare landed in the lives of very, very at-risk, socioeconomically marginalized women here in BC. So our research project was a participatory action research project partnered with Dr. Leah Karagata, who is an associate professor and director of the School of Social Work at the University of British Columbia. And we actually hatched it before the pandemic and carried it on all through the pandemic, and then came out on the other end with our data. But we did, so the peer researchers went out, trained, shaped our interview questions, and we interviewed mothers. Yes, accessing $10 a day childcare, and here in BC are fully universal spots with the affordable childcare benefit. So we're talking about $0 a day childcare for people very below the poverty line. And then our other group that was accessing fee-based spaces, so quality licensed spaces, but still having to pay fees, although the discounts made a huge impact. And what we found was just profound. So we're approaching this as an anti-poverty organization with a human rights approach. And the research, we did want to look at the multidimensional health and well-being impacts of childcare, including the economic impacts. And so that's why our report is called A Whole Life, because this is precisely what we learned. So when we talked to the mothers who are accessing $10 a day spaces, the impacts, we looked at the economic impacts, the health and well-being impacts, and the impact of quality care on their at-risk and quite marginalized children. And just to begin, okay, first of all, we want to believe, childcare is a poverty reduction strategy. Well, in this case, 100%. We talked to mothers who had been quite entrenched on income assistance and welfare for a very long time. They were able to access a fully universal $10 a day childcare space and literally vaulted into the labor market And one of the biggest impacts that we captured was their uptake of, now this echoes everything you said tonight, Jim, quality full-time employment with wages, benefits, pensions, so that the quality uptake. So the group that we engaged here, they have, very high uptake of precarious gig work, yoking it together, shift work around the clock, and tend to be overrepresented in lower wage sectors, frontline hospitality, residential care homes, often very female-dominated sectors. So they are working for lower wages. And, even though they access $10 a day childcare, they didn't necessarily vault into higher income brackets. However, one of the biggest impacts was, yes, they were able to access work and the work that they wanted. A lot of them went from part-time precarious work to the full-time work that they wanted. Some just wanted part-time, and they were able to access more quality part-time work. So, not necessarily just patching it together. But yes, all of them in the $10 a day group. We saw what Jim has presented tonight actually taking place in the lives of very, very marginalized families. So the last thing I want to say is that the group that was accessing, still having to pay, higher fees, did not fare as well. And that was partly because with their salaries being lower generally, they weren't able, still having to pay the fees. They still couldn't they didn't make the leap to the full-time employment. They were still juggling, still dealing with the hectic scramble of, adding gig work, Uber, skip the dishes, cleaning houses, all the ways in which, women living below the poverty line, raising children, try to survive. So the benefit of the $10 a day, fully universal, $0 quality spots was that the trickle-down health and well-being impacts were just gorgeous. We heard from parents, for example, so their time poverty decreased, their ability to participate to join the pack, to show up for their children's recitals. So they felt that their toxic parenting decreased, their stress levels hugely decreased, their connection to their children increased. And we're talking about at-risk families with a lot of deprivation across all areas. So I just want to mention that multidimensional health and well-being impact for at-risk families is something that, Jim, you mentioned sort of daily. We can see these impacts now. I guess our work is to daylight these impacts on families that are very marginalized. And there's just one story I want to share as well. There was one participant in our study who lives with HIV in Vancouver's downtown east side and was not able to actually access the HIV clinic because they didn't have childcare. And they're not allowed to bring their children to the HIV clinic. They're not allowed in the clinic. So they were missing their healthcare treatments. Now, this mother, with the help of agencies, attained a fully universal subsidized $10 a day spot, was able to access all of the healthcare and the treatment that they needed. Then, they moved forward, their economic situation improved. So that's why I just want to sort of bring to this discussion that, yes, we want to talk about labor market attachment and the opportunity to shift up and out of poverty with $10 a day childcare as a bridge. But also these other impacts are so important to bring to our discussion. They are invisible, but when it comes to accessing healthcare and, women's human right to benefit from childcare. So I think I'll stop there. I have much more to say, but I can put a link to our research report in the chats if that's useful for everybody. Thank you.
Thank you for that really important work, Viveca. Really putting a face on some of those numbers that Jim presented earlier in our discussion tonight. That's marvelous. Thank you so much. We have a little bit of time left. Maybe I'll just open this up to all of you. One of the things that I'm hearing on the radio and the media reports is that the $10 a day program is failing because nobody can get into it. The wait lists are too long, and families are now the fee centers. Some of the centers are leaving the system to charge full fees again. And what do you make of some of those claims, Jim?
Well, Laurie, I can't comment totally on the wait lists. I haven't seen data on it, but there certainly are wait lists, and we have to get rid of them. I can confirm that the number of spaces is growing, and the number of people working in centers is growing, and that the overall supply has increased. Now, part of the situation here is the idea of accessing $10 a day daycare is so appealing. Lots of parents want to do it. So, obviously, part of the wait list is the demand. So, there was some Fraser Institute reportage a couple of weeks ago that says wait lists are worse than ever. The program is a failure. And that is not the conclusion you can get from their numbers. In fact, I would say it's a success because it shows how many people want it. But it clearly creates a need for the next stages of the rollout to focus very much on increasing supply as much as possible. So, but clearly the evidence is there that more people are taking advantage of this program.
Michele, what are you finding in your centers? Have the wait lists exploded? How are you managing those increased the demand?
Yeah, well, certainly our wait lists are long. There's no doubt about that. But I would echo what Jim said. I think it's evidence that this is something that people want and are yearning for. So it's incumbent on us to figure out all of these things that are getting in the way of expansion happening in a more expedited way so that we can make those spaces available. We talk a lot to our families, and people understand that it will take time to build the first national social program Canada has introduced since Medicare in the 1960s. I mean, this is massive. It's monumental. It's historic. It's going to take a bit of time. And, we're dancing as fast as we can to meet that demand. I did want to touch on something that Toss said about when we improve the working conditions and the wages for the educators, that people come back or they stay. And I will tell you, Mothercraft's worked really, really hard to bump up our wages over the last 5 years. And we've always had pension plan, we've always had health benefits, which is why I'm happy that we're moving to a cost-based system, because we can actually figure out ways to enhance those even further. But we've seen our retention rates or turnover rates reduce. So people are seeing the value of childcare and early childhood education being more prominent in public spaces. Parents have always needed it, and now they're saying, "Oh my gosh, maybe I can actually get it." And we're really working, I think, diligently to try to realize the big ambitions of the system. But it is going to take a little time, and it's going to take more money, quite frankly. I mean, I mentioned capital. There's also, the targets that the Fed set is for 59% of children under 6 to have access to a space. In Ontario, it's only at about 39 as a target. So we got a long way to go to really have this be a robust, fulsome national system. But I don't think that we should be dissuaded by people who are afraid they're going to lose profit. You know what? When you're getting public money, you got to be accountable, and there's limits on what you can put that money towards. And that's fair. And if you want to remove yourself from the system, then go for it. The rest of us will build it, and we'll build it in a high quality way, in an accessible way, and with an equity lens for everybody, both families and educators.
Viveca, any thoughts on the wait list and what it means?
I do have a thought, but did you want to go first? Did you?
No, you can go, Viveca.
Okay. Yes, I have much to say about waitlist. I think here in British Columbia, we have 15,000 spaces, nowhere near meeting the need across the provinces. I think is the case everywhere. And I want to, tread carefully here. But I think, when we have a situation of scarcity, we have, people are fighting to get in. They're fighting, battling each other on the waiting list. Thankfully, BC banned charging fees, not for everybody, but some providers. So obviously, when we get into the weeds of this discussion, we go quickly to equity-seeking families, marginalized families, who is likely to be most excluded from those wait lists. Here, they have their existing wait list, they become a $10 a day center, those wait lists are still functioning. However, and speaking from this perspective of an anti-poverty organization, having done this research for quite a few years, I think we want to be really careful not to get pulled down into this notion of, okay, well, there's scarcity, we don't have enough spaces, so we need equity measures, when our vision here is for a fully universal system that was promised to us federally and provincially even before it was promised federally. So, you know, our position is to light the gas under the completion of our universal $10 a day fully subsidized system, not the patchwork. Some are fee-based, some are so that we can actually reduce these waiting lists, rather than sort of pit families and different kinds of families against each other in the struggle for childcare, which is where we've been for many decades until all this beautiful advocacy was so successful and we got this system. So I just wanted to bring that in, that I don't want to sort of, you know, that danger of sinking down into this battling for spaces, when I think we need to really strongly collectively advocate for to truly build the universal spots, right? Those fully publicly funded $0 to $10 a day spots that we know have the real impact that I believe Jim has illustrated and that we've talked about tonight. Thank you.
I remember, you know, back in the 80s when childcare was part of in Ontario anyway, part of the social services, the welfare system. And we all know that, you know, in the social service sector, programs for the poor make poor programs. That your best chance of maintaining universal programs is everybody's involved, because then you get the well-heeled, educated parents who hold on with both hands, and they have the power to propel it forward for everyone. And that's a very good point you make, Viveca. Ty, any thoughts on this?
Very quickly, I think it's important to remember that childcare waitlists being long is not a new phenomenon. It's not a recent thing that we inherited from the 10-a-day childcare program. Childcare waitlists have always been long from years of not having a system that we have right now. And this is a fun way to break the news that I'm expecting, but I'm I'm responsible for growing the wait list of probably 15 different centers around me. And it's because now I have that choice. That wasn't a choice for me before because it was unaffordable. But now I'm on the wait list because this is a new choice that I have as a parent.
Wow, wait lists are actually choices. I see we're rapidly approaching the hour. Morna, did you have any closing thoughts?
Very briefly, first of all, big thanks to all the presenters and Laurie, to you for your moderation of this event. I think it's been a really successful event. We've heard a lot of very good information. The chat has been alive with debate, and that's a really good thing too, because when you build a new system that involves large public investments, there are going to be some who oppose and some who support. And I would just urge us all through this debate to be respectful of different opinions, but also to pay close attention to evidence. And so when statements are made about inequitable access, let's get some hard, good data on that question and figure out what is causing the limited access. Viveca's organization has done some very good work in this area. But we need to do much more. Similarly, questions around, you know, what is the best strategy for raising wages and improving working conditions? Is it unionization? Is it not? If there's unionization, does that mean everybody will go out and strike? Again, this debate should be informed, and you know, that's true for a number of the issues that have been raised. So let's have more of these discussions, not less. Let's get everybody into the discussions, having the debate. Thank you for helping us with that. And looking forward very much to the next one. This concludes our 10 days of action for the in support of the $10 a day childcare program. We need it sustained. Very importantly, we need it strengthened, and we hope we can count on everybody to help us achieve that goal. So please join in. Go to childcarenow.ca. Subscribe to our newsletter if you haven't already. Please take out membership. We're always open to donations, funding donations, so we can carry on the important research that needs to be done. And to support the debate that needs to continue. Thank you. Thanks so much, Laurie, and thanks to everybody who joined us tonight.